Welcome, everyone, to today's episode of The Lindsay Elmore Show. Today, I speak with Dr. Paul Anderson about the generational shift that is occurring in the treatment of cancer. Gone are the days where the doctor knows everything and the only type of treatment course is the one that he or she prescribes. Nope. These days, patients are looking for a wide variety of treatments. And Dr. Anderson has 30 years of experience in integrative and holistic cancer treatments. Today, we talk not only about how critical it is to have a healthy diet and an exercise routine and a sleep routine, but really how mindset can affect the outcome of our treatment course. We dig deep into how to not get stuck in the process of processing a cancer diagnosis. Let's get to the show. Welcome to The Lindsay Elmore Show, a podcast that helps you find fulfillment amidst chaos. On this show, I interview thought leaders, doctors, creatives, spiritual gurus, and game changers who inspire you to pursue your dreams, overcome obstacles, and leave your mark. Dr. Paul Anderson is a naturopathic medical doctor who focuses on complex infectious, chronic, and oncological illnesses. He has 3 decades of clinical experience and served as the lead investigator of an NIH-funded human research trial using intravenous and integrative therapies in cancer patients. He founded Advanced Medical Therapies in Seattle, Washington, a clinic that focuses on the care of patients with cancer and chronic diseases, and now focuses on clinical collaborations with clinics and hospitals in the United States and other countries. He is the author of Outside the Box Cancer Therapies with Dr. Mark Stengler, as well as co-author of the anthology Success Breakthroughs with Jack Canfield. His latest book, Cancer, The Journey from Diagnosis to Empowerment, is about the process of dealing with a cancer diagnosis for yourself or for a loved one, and how we can become empowered even during this difficult journey. In the book, he writes that the goal is to increase the quality of life and relationships even while cancer is a part of your life. Today, he and I talk about how we can approach cancer differently and become empowered owners of our own health, even when we face what can be the most devastating of diagnoses. Dr. Paul Anderson, welcome to the Lindsay Elmore Show.
Thanks for having me.
You have 2 books about creating empowered patient journeys through cancer. You have a newer book called The Journey from Diagnosis to Recovery, as well as Outside the Box Cancer Therapies. Now, when people get a cancer diagnosis, it can seem like the whole world gets turned upside down, but yet cancer in many ways is not so very much different than many other chronic diseases. And so how have you begun to think about cancer differently? And what are some of the more out-of-the-box interventions that you have seen really transform patients' lives?
That's a great place to start. I think one of the things that has been transformative, at least in my world of cancer care, has been if I go back, say, 30 years to when I started till now, there's been a lot of evolution in oncology generally, and also in the area often that's described that I do is sometimes called palliative or integrative or some mixture of those sort of things. So my job is, just so people know, to orchestrate all of the things that the medical or radiation or surgical oncologist is not doing. and they have very big jobs. So I like to start out by saying they're not doing anything wrong. They have extremely highly critical jobs, and their job, if they're giving you chemotherapy, is to do it in a way that does not harm you, et cetera. If it's radiation, same thing. So while they are aware, and I have a lot of colleagues in those areas, while they're aware of a lot of these other things, it's not within their time scope to deal with it, even if they want to. So what people like myself do then is to step in, and I always tell people, sort of like there's this sliver of the pie that you're let's say you're going to do chemo. Not everyone does, but let's say that's the common thing. So that sliver is cared for by this team here, at the hospital or at the oncology clinic. The whole rest of the pie has to be taken care of, but they don't have time to get much into it. So what we do is the rest. Well, literally, I'll be generous, 20 years ago, but even more recently than that, a lot of the oncology community was very suspicious of what we did in the rest of the pie, and they would say, well, we won't treat you if you go see Dr. Anderson, because we don't understand what he's doing. Most of them, it wasn't personal. It was just they didn't understand. Well, the big shift that's happened, and I think this is really, goes to what led to both of the books, is it's a little bit, doctors communicating better and publishing more stuff. And I was involved in NIH research and all that business. But really, I think what drove it is patients becoming empowered, because we finally got this generational shift from the doctor is always right, which, I mean, if you're a doctor, wonderful, that's great to be always right, but you aren't. We shifted from that to, well, wait a minute, you're really good at this area, this piece of the pie, but you don't really know about all these other things. And so can't I get an expert in this area? And the shift that I really saw was a little bit on doctors' communication side, but really more the patients getting into it and saying, no, you are going to treat me, and we are going to work as a team, with whomever to help me. And so the rest of the pie, would include all sorts of things, diet, lifestyle, what do you do with your, exercise when you're during chemo and you don't feel well, and what, all of these things. And then there's a lot of other outside the box things. So I think the biggest change has been facilitated by patients being empowered, and now oncologists are more used to having the conversation. It used to be they could just cut people off. And when I was training, a million years ago, that was what doctors did. They just cut people off when they got to these uncomfortable conversations. Now people don't put up with that. So I really think the empowerment of the human in their care, it forces us doctors to listen to them. And I think that's been the biggest revolution. And then, everything flows down from that, all the technical stuff.
So do you think it's more about patients learning on their own, or do you think it's because people have worked with naturopathic medical doctors such as yourself to discuss exercise and diet and all the things that can make the journey of cancer a more tolerable one, and one that is potentially even going to help increase your odds of survival? How do you think this shift began to occur, and what do you think have been the most important touch points along the way that has led people to have a greater conversation about totally integrative care during cancer?
Yeah, I think it's, of course, multifactorial. I do believe, whenever you have a swing of a pendulum from, sort of very restrictive to, no, we want options, there's a knowledge gap. And so a lot of it is people trying to become educated and informed, and doctors trying to become educated and informed in this big knowledge gap. And so then that creates a lot of, uncomfortable situations where we don't have answers to everything. But the patient says, well, I read about, this, what is this, can I do this, or whatever. And one of the reasons Dr. Stengel and I wrote the first book, which is much more about therapies and, integrative and outside the box therapies, was to show how much science there is. But the other thing was to educate patients so they could say, okay, these doctors together have done this for 50 or 60 years. If they were going to tell you to put your resources in an area and you had breast cancer or, colon cancer, their top 5 would be here. It maybe wouldn't be one of these things over here. Not that they're bad, but just this is what we see work more often. So I think it's this nice mixture of patient empowerment leading to curiosity, doctors getting sort of way more up to speed on what these things are, and then the science sort of meeting in the middle. And so I think it's been a really good time. Now, for a lot of healthcare providers, quite honestly, the internet was a really shocking turn for them to have, because suddenly you get patients bringing you in, maybe research studies you've never heard of in your life, right? So in the beginning, it was caused a lot of problems for patients trying to get info. Now it's a little bit more, certainly any doctor who's been alive or trained in the last 20 years, now at least they have a way of saying either, gee, I'll look into that, or, oh no, I read about that, but we're not really doing that. We're doing this over here, and here's the difference. So I think a lot of it is just this evolutionary change. The other thing that I saw was in the beginning of, so we're going back now about 10 years ago, there was a 5-year-long National Institute of Health funded study. I was a part of it. I ran an interventional clinic, which meant IV therapy and things of that nature. And it was all the NIH wanted to see if people who did integrative therapies with their regular therapy or just regular therapy, did one live longer or not? And later we looked at quality of life, which was better. And indeed, our patients did live longer, and we weren't, counteracting anything. It was a whole thing. That caused a lot of evolution in just this communication between, kind of traditional oncology, et cetera. It's not like people suddenly were, heaven opened and everything became easier, because in North America, of course, we have this layer called insurance that gets in the middle of everything and creates a financial strain. So, so I think that, it's just been this nice collage of mostly patient empowerment and education, doctors having to get up to speed because of that, and then better communication kind of around the points of the compass.